Good evening. I'm Dr. Richard Pan, State Senator representing Sacramento, and pleased to be here for Maxed Up. But I'm also wanting to talk about a very serious issue that has been happening with the COVID pandemic over the past year, but really has its roots that go way before that. And that's hate being directed toward Asian Pacific Islanders here in the United States. And we saw that last week when on the same day a report came out from Stop AAPI Hate that reported on a increase in hate directed toward Asian Pacific Islanders in the United States, how that had increased, and the fact that particularly so many women were reporting hate incidents. And then that very evening, the news that that 3 Asian businesses were attacked and 8 people were murdered by a gunman who also killed 6 Asian women. And I think it was a reminder to people that this hate is not only very real, but also very deadly, and that we as a community need to stand up together. Now, we have seen, again, this rise in hate incidents toward Asian Pacific Islanders, which also seem to be enabled by rhetoric that made Asian Pacific Islanders targets, coronavirus being referred to as a China virus or the Kung flu. But this is also part of a pattern in this country going back to the Chinese Exclusion Act back in the late 1800s, the incarceration of Japanese Americans during World War II simply because of their ethnicity, the murder of Vincent Chen by people who accused him of taking their jobs in Michigan, and then basically not suffering much punishment at all. And then after 9/11, attacks on Muslims and South Asians and Sikhs as well. And then certainly with COVID, again, we've seen this spike in incidents against the Asian Pacific Islander community that had persisted, not only hate incidents, but also prejudice and discrimination against Asian Pacific Islander businesses, which actually suffered a significant drop in their business even prior to the public health orders related to COVID. And this is something we've seen not only in the United States, but other parts of the world. But here in the United States, we can certainly do better. So I'm very hopeful that we are seeing so many people standing in solidarity with the Asian Pacific Islander community. But we also do see people as well who have continued to perpetuate myths and prejudice toward the Asian Pacific Islander community. So hopefully we can come together as a country and say, no, this is wrong. Racism is not acceptable. And certainly during a time like this, when we have COVID, there is increased fear. But that fear should not be directed toward a particular race or ethnicity. And unfortunately, that is what we've seen, but we can do better. So again, I appreciate that tonight here on Masked Up, Andrew's going to be talking to actually one of the founders of Stop AAPI Hate to talk about what they have found and some things that people can do. One of the things that I would just want to ask everyone is to, first of all, please listen to your Asian Pacific Islander friends when they talk about their incidents. Help support them when they've are feeling under attack, which our community is, and be sure that you also help elevate their voices. And if you see an incident happening, please show your support and intervene, but also de-escalate. We don't need to have violence happening, and that should not be what is acceptable. So with that, I want to thank you all for joining us tonight, and appreciate that we're going to be addressing this other aspect of dealing with the COVID pandemic tonight here on Masked Up. So thank you so very much, and thank you so much for joining us tonight.
times where the rug is really pulled out from underneath you. And I think that this is one of those times.
You feel numb because there's just been so much going on within our community all over, not just the US, but even the world. And it's kind of morbid, but you're thinking it was just a matter of time for it to happen down the street from you.
Being Asian American, whether or not the attack was directed towards you, it's one of those things where if somebody in your community is affected, you feel the brunt of that too.
The normalization of the hypersexualization of Asian American women, or Asian women in general, that's rooted in imperialism and colonialism, really helps to facilitate and creates a breeding ground for increased sexualized violence against Asian women.
The murderer pretty much said that it was because of his sex addiction and it wasn't racially fueled, but there's obviously a connection and they're not mutually exclusive.
My mom is a Korean American woman who had a small business, and so she's in that arena, and a lot of my friends' parents are in that situation too. So for me, it's more of the parents' generation and our families that I'm really thinking about in this situation.
I certainly think that it's a moment where people are really coming together. I mean, that's been my experience today, is that people are coming together to respond.
I am Korean, but I didn't need to know that for me to care. I didn't need to know that for me to feel hurt and pain as if it was a family member of mine or a friend, because as Asian Americans, or as Asians, as minorities, we understand the perspective that is put upon us when white supremacy is the framework of how everything's built. So it's a shared trauma and it's a shared burden.
What is up, y'all? Beams. My name is Andrew Defy, and welcome to another episode of the Masked Up Community Health live stream. This is generally the part of the show where I crack jokes to open it up, but it's a little heavy tonight. Our show tonight focuses on the rising epidemic of anti-Asian violence in America. This past week, 8 lives were senselessly cut short in Atlanta because a straight white man with a weak beard and a sex addiction had a bad day. Now, before you get mad at me, that's what the police spokesman said at the press conference when addressing this heinous act. Now, the murderer, whose name shan't be coming out my lips, had a bad day. The same police spokesman, Jay Baker, bought this shirt that says coronavirus imported from China, and it's misspelled so that you can almost hear Donald Trump saying it in your head. He posted that around this time last year. This is why NWA made that song so many years ago. This guy, Jay Baker, should be kicked off the force, but he won't be, because the inherent bias sewn into the officer's Bill of Rights, and also because American police as a system have racism built into their structure and active officers such as Jay Baker working to uphold it. The entire narrative around this event is being skewed from what it should be. Hashtag Stop Asian Hate started trending, but it needs to be replaced with hashtag Stop White Terrorism. Whether we're talking about the LGBTQ community, the Black community, or now the Asian community, the gunman always looks the same. We know the description before they release it. And as a straight white man, I'm just saying we have to start taking accountability for our own. Why is it always us? That's not a rhetorical question. It's because white fragility and white supremacy make us weak. It is only the most cowardly that would commit an act like what happened in Atlanta, but it will happen again sooner than later, and y'all don't want to talk about that. White terrorism is like that old whack-a-mole game. It's only a matter of time until another weak, straight white man pops up and commits another atrocity against minorities and is brought safely into custody to be questioned. Hate is a feeling, and it's a lot harder to stop people from feeling feelings than it is to stop people from committing actions. Think about it. You can't whack the mole when he's thinking about coming out of the hole. You have to hit him in the face as soon as he actually comes out of his hole and put him back in it. But this isn't a game. People knew this guy. And I guarantee one of them was another straight white guy, a brother, a cousin, a dad, a neighbor, a friend, a trusted coworker, white women in his life. You are not off the hook. Those are the people close enough to stop this from happening. Those are the people that can actually stop white terrorism. What can anyone other than us do to stop this uniquely American brand of domestic terrorism? The onus may be on all of us to hashtag Stop Asian Hate, but the work of real life stopping white terrorism is first and foremost on the white community. And we need to do our work and not look at everyone else as though we're not the reason the hashtags exist in the first place. Whether it's Black Lives Matter or Stop Asian Hate, it's all just a response to the violence of white supremacy. To our Asian family, stay strong. You are loved, you are valued, you are not alone. We are standing with you and we will continue to fight alongside you. It's important in these times that, especially for us white folks who claim to be about this anti-racism work, that we are listening to our Asian family. So we want to give a special thanks to Dr. Pan for starting our show out tonight. All of that needed to be said, and most importantly, it needed to be heard. Now we can start the show. Let's get into the latest, the weekly Rona update. So first in Rona news, as we reported last week, theme parks are opening in California. There was a lot of confusion and a lot of memeing going on this week as we all tried to clarify whether we were allowed to scream on roller coasters or not. Luckily, the Sacramento Bee's Don Sweeney has clarified it for us, sort of. In an article released last week called "You Can Still Scream on California Roller Coasters, but Keep It Under Wraps," parks say, that made it to Yahoo News this week, we get this invaluable insight. Will screaming still be allowed on roller coasters when amusement parks reopen? The California Attractions and Parks Association, which represents Disneyland Resort, Knott's Berry Farm, and other top amusement parks in the state, says screaming, shouting, and hollering will need to be mitigated on roller coasters and other rides when parks reopen in April. But it stopped short of an absolute ban, like one implemented at a park in Japan in response to the coronavirus pandemic that urged visitors to instead scream inside your heart, BBC News reported. I mean, I feel them. And it's not like park visitors didn't live through 2020, and by now we all know how to scream inside of our hearts. This article went on to say a bunch of other really unclear stuff about how this is all going to work. So I'm going to stop reading it, but we are going to acknowledge that it's not Don's fault. It's hard to write with clarity about something so vague and unknown as we are facing right now, and I just want to name that. If you are feeling unclear right now, take solace. So is the happiest place on earth. And we're all just kind of going to be in this unclear space for a little while longer. So let's keep giving each other some grace as the world opens back up. And remember, none of us have ever done this before. And if you do have to yell at someone, I mean, yell inside your mind. So California not doing so great at these vaccine distributions. California is among the worst in getting vaccines to vulnerable populations. A new CDC report finds. This story comes to us from Ivan Pereira of ABC News. About a quarter of California's population has received one shot of the corona vaccine so far, according to data from the Centers for Disease Control and Prevention. However, most of the shots so far appear to have gone to populations that are less vulnerable than others. State health officials say they are working to improve those numbers. The CDC issued a report last week that measured counties' vaccine rollouts with regards to social vulnerability. The vulnerability index included several factors, including race, education, poverty level, and housing, which the agency also noted has been linked to higher coronavirus rates. The results of this study indicate that COVID-19 vaccinations coverage was lower in high vulnerability counties than in low vulnerability counties, a finding largely driven by socioeconomic disparities, the report said. The report examined 49 million shots distributed between December 14th and March 1st. Of the 48 states surveyed in the report, California ranked 44th when it came to vaccinations among residents in the highest socially vulnerable counties. About 1 in 4 shots went to those counties, the CDC said. The states that ranked below California in vaccine distribution in the most vulnerable counties were Kansas, Maryland, Idaho, and New Hampshire. On March 4th, California Governor Gavin Newsom and state health officials announced a plan to double the allocation of vaccines to the hardest hit areas in order to address the inequities of the vaccine rollout. In a statement to ABC News, the California Department of Public Health said the CDC report underscores their latest efforts to get the shots to the state's most vulnerable communities. With the implementation of the statewide vaccine network, the state will be able to accurately collect data on who has been vaccinated and direct vaccines and resources to communities where vaccinations have lagged, the department said in the statement. So now we're going to get into some of the latest health news. This week's latest health news comes from the LA Times article, Atlanta Spa Shootings Stir Fear Amid Historic Rise in Hate Crimes Against Asian Americans. This comes to us from Jawed Kaleem and Richard Reed. Police on Wednesday charged Robert Aaron Long, 21, with 8 counts of murder and homicide and 1 of aggravated assault in the Tuesday killings at 3 spas in and around Atlanta. Police said the early stages of their investigation indicated that Long did not appear to be motivated by race and was possibly seeking revenge on women at spas he frequented out of frustrations with what an official called his sexual addiction. But for many Asian Americans, the killings further fueled fears about anti-Asian hatred that has mounted over the last year as police and advocacy groups have reported record numbers of hate crimes and incidents of harassment. Activists have pointed to former President Trump as being responsible for some of the hostility toward Asian Americans, citing his use of terms such as China virus, Wuhan virus, and Kung flu, in referring to the coronavirus, which was first detected in Wuhan, China. Asian American civil rights groups have raised concerns about violence in recent weeks amid new data showing a historic rise in anti-Asian hate crimes across parts of the nation with the largest Asian American communities. In a survey of police departments in 16 major cities, the Center for the Study of Hate and Extremism at Cal State San Bernardino tallied 122 anti-Asian hate crimes last year. The number was a 149% increase from the 49 in 2019. New York, Los Angeles, Boston, Seattle, and San Jose saw their highest numbers of anti-Asian hate crimes in at least 5 years. The overall increase in the 16 cities surveyed came as the total number of hate crimes against all minority groups in those cities declined from 1,845 to 1,717. In Seattle, anti-Asian hate crimes increased by 33% in 2020, a jump from 9 to 12 cases. Hateful incidents have continued this year, including messages, "China, you will pay," and "Go home," written in hay this week in parking lots of 2 Seattle churches whose congregants include Asian Americans. Kendall Kosai, an Anti-Defamation League Associate Regional Director in Seattle, said in a phone interview that regardless of the intent of the suspect in the Atlanta attacks, it sends a chilling message to the Asian and Pacific Islander community. Kosai, a 4th-generation Japanese American whose grandparents were sent from Kent, Washington to an incarceration camp in Wyoming during World War II, said he feared that Asian Americans will start feeling ashamed of who they are and stop embracing their cultural heritage. This week, Stop AAPI Hate, a tracker launched a year ago by Asian American advocacy groups, released data on 3,800 incidents of harassment and violence against Asian Americans that took place over the last year. The majority of reports, 68%, targeted women and involved harassment. People of Chinese and Korean descent were the most frequent victims, with many perpetrators verbally blaming Asian Americans for the pandemic. The organization said in statements Wednesday that it believed racism could be a factor in the Atlanta incidents. Police have so far emphasized other possible reasons for the killings. As the facts of the Atlanta tragedy continue to emerge, it's important that we do not rule out racism, Stop AAPI Hate tweeted Wednesday. Law enforcement is leading with a narrative that yesterday's violent incident was not racially motivated based on the shooter's testimony. The fact remains that all but 2 of the victims in this tragic incident were Asian American women, and that these were all Asian-owned businesses. And this brings us to the racism crisis. Now, we have talked a lot about anti-Black racism or just general racism against people of color, but this week's hellacious attack on Asian women in Atlanta gave us a very devastating example of what the AAPI community, especially Asian women, have been telling us for a while now. That corona isn't the only virus to spread rapidly through America in the last year. Anti-Asian racism has hit our AAPI family from the elders to the youth. Check out this video article from Catherine Ung that ran last week in the New York Times called Coronavirus Racism Infected My High School. Let me pull this up for us real quick.
Everyone knows Chinese people are disgusting. They'll eat
Thank you, Katie. I'm going to fix that right now. Sorry, we didn't have audio on that. I'm going to bring that back up with some audio right now. I appreciate you, Katie, and I appreciate all of you in the comments and everybody tuning in right now. All right, let's see. And here we go. Should have audio this time.
Everyone knows Chinese people are disgusting. They'll eat any type of animal. They're dirty. That's what my classmate said just days after the coronavirus outbreak started in the United States. It felt like a stab to my chest. I'm Chinese American, and this is someone that I've gone to school with for almost 3 years, who I consider a friend. But it's no wonder that she feels this way.
An obscure virus arising from a meat market in eastern China.
As the coronavirus spreads, there's another virus spreading that we need to be talking about.
I hate Asians.
A woman who's Asian says she was punched by another woman in Midtown Manhattan, and she accused her of having the COVID-19 virus.
I don't want them under me. Tell them to move.
Young Asian Americans like me are feeling hate infect every part of our lives.
I'd like to just ask the Chinese for a formal apology.
Not only do we have to be afraid about our health, but we have to be afraid about being ourselves.
Class basically just started, and one of the girls said all Chinese people were disgusting. And so I literally raised my hand. I was like, I'm Chinese. She didn't even say sorry. She just blew past it, I guess. And then she kept going on about it. I never knew it would happen to me, especially at this school.
Good morning.
Morning.
你在看什么东西？哦，我在看那个 coronavirus report。
学校有关于这方面的 bullying 的话，你要跟那个我们说，要跟老师说，知道吗？这是不对的。
嗯。
This Chinese restaurant was like texting their customers saying, none of our staff have been to China. We have no contact with the coronavirus. Please, like come back to us. And people were like making fun of it.
There are thousands and thousands of cases in Italy, but no one's boycotting
No one-
Olive Garden.
yeah.
No
Like,
one, no,
yeah.
seriously, like no one's boycotting a mom and pop's pizza place. Like, it's the same thing.
Historically, pandemics have stoked xenophobia. In the 19th century, people spread rumors that Irish immigrants carried cholera, and tuberculosis was known as the Jewish disease. In 1900, when a Chinese man supposedly died of the plague in San Francisco, Chinatown residents were forcibly quarantined by police, while white residents were allowed to leave the area. It seems like since the start of the coronavirus outbreak, schools have been a petri dish for racism. It's dangerous to normalize behavior like this for people my age.
So you just spoke with the other student. So can you tell me what happened?
She understood like my frustration and anger. They didn't really mean to say that, and they were actually making a generalization. And so she apologized to me basically, and I really appreciated it.
Coronavirus may have originated in China, but the disease doesn't discriminate in the way that people do. It's extremely important that people have accurate information on how to stay safe so we can kill this virus without spreading another one.
Man, heavy for being so young, man. We got to do better for these kids. So, earlier this week, we were lucky enough to get a few minutes with Dr. Russell Jeung. In between all of his work as co-founder of Stop AAPI Hate, the organization we heard about earlier in the LA Times article working to document harassment and violence via their online tracker, here is what Dr. Jeung had to say about this week's events and what we can help do to support our Asian and Pacific Islander family in these times. Hey, Dr. Jeung, how are you? You're a very busy man right now.
Yeah, tired and still grieving over the shootings, and so it's been a hard week, and I think it'll take a long time to mourn and to support our community at this moment.
Absolutely. So, racism towards Asian Americans is not new, but recently it feels as though more Asian Americans have been speaking up and protesting. Why do you think that is?
I think we're protesting because we have very good reason to be. We created Stop AAPI Hate because we knew the racism would be coming, and it has. We knew that we would be met with violence, and we have been, and we knew that racist policies would be implemented against us, and they have been. So we have every reason to be angry. We have a youth group, campaign, and our youth interviewed 1,000 Asian American youth, and their dominant feeling is anger. We're angry at the system, the failed ideals of America. We're disappointed in our government. We're angry that Black lives don't matter, and we're angry that our families are getting pushed and shoved, especially our elderly. So we have a lot to protest about.
And, you touched on it a little bit on AAPI Hate and Stop AAPI Hate. Can you tell us a little bit more about the organization and the process of founding that?
We, again, because I teach Asian American studies, I knew from past history that whenever an epidemic arises from Asia, Asians get blamed for it, and then they, again, meet violence and racist policies. So we wanted to be prepared. That happened in SARS when people were pushing and shoving and shunning us. And I saw early on in news stories, and I actually tracked global news stories and domestic news stories, that this type of behavior was increasing. I worked with two community groups, Chinese for Affirmative Action and the Asian Pacific Policy Planning Council, which is in LA, and Chinese for Affirmative Action are in San Francisco. And we began to strategize on how we could track the racism, because unless we documented what was happening, nobody would believe that Asians would face racism. People would say, oh, these are just isolated incidents of a few ignorant people. And so we really wanted to document it. The API Legislative Caucus were really supportive. We went to the Attorney General's office and wrote him a letter asking him, can you start tracking? This is happening. We've already documented in the news accounts. And he said they didn't have the capacity. So we created our own website. And with the help of the API Legislative Caucus, we got a lot of publicity. And on the first day, we got like hundreds of incidents. And I was stunned by, first of all, the volume of incidents. And secondly, the vitriol and the hatred expressed by perpetrators when our respondents talked about what happened to them. People were spewing, slurs at them and profanity, racial epithets, and it was just horrifying. So that continued. Because we're based in the community, because we have multiple language platforms, we continue to get 100 a day, and then from across the country, not just California. So we saw how widespread it was, how it ranged in the type of discrimination, how it popped up in lots of different sites, from schools to public transit to private businesses. And so we just got a lot of data to document the racism and the trends that were happening in real time.
And there was a report in the LA Times that we reported on earlier in the show, released by Stop AAPI Hate last week. You want to give us a little backstory on that report and your findings?
Right. So this week is our 1-year anniversary, and we tabulated our data up through the end of February, and we found nearly 3,800 incidents. Again, they ranged into 4 main categories: civil rights violations, where people are mistreated at work; online harassment; microaggressions like verbal harassment and shunning. But again, they're not micro, they're actually pretty macro. People have been racially traumatized. And then the 4th category is assault. Part of the assaults were just physical assaults, where we were pushed and shoved and had bottles and rocks thrown at us, or people actually tried to run us down with their cars. But part of the assaults was the coughing and spitting at us. And so we saw that happen so much, we created a special category for it. And people are just treating us so subhumanly that they feel like they can cough on another adult. Right? People asked, well, has racism increased since last year? And I go, I don't know. I didn't see anybody coughing or spitting on a fellow human, in 2019. But now it's happening across the nation. And it's just really weird that that people have license to spit on another person. And I think it's pandemic related. I think they think we're the infection and they want to reinfect us.
What would you say to someone who thinks that these recent anti-Asian incidents are just singular acts that don't represent a systemic problem?
Well, you can look at our data. We have 3,800 incidents, and you don't expect limited English people to go and report something. They don't report to the police. They don't report to legal authorities, but we're getting them from non-English speaking people. You don't expect seniors to go and complain and to go online and type in a report, but they are. Disproportionately, our numbers are seniors. So that indicates that we're just getting the tip of the iceberg. And if they're so angry that we have hundreds of seniors complaining, there must be thousands more who aren't reporting, right? Other surveys also confirm our data. They show that the lowest estimate in California was that 7% experienced direct racism. That doesn't sound like much, but that's 400,000 people in California. That's 1,000 incidents of hate every day. So you could say, oh, it's just isolated, but you ask any Asian now, that survey was done last year, early in the pandemic. More recent surveys say 3 out of 5 Asians have experienced it directly. So you could ask any Asian, they're probably 1 degree away from separation from knowing someone who's been harassed or yelled at or shunned or pushed and shoved. So, they could not believe it, but they just could ask every Asian they talk to, and every Asian may have a story.
So what can we do as individuals, both Asian and non-Asian, to address this stigma? And then I'm going to ask as well, what should policymakers do to address anti-Asian racism and violence?
I think I could name 5 things right off the top of my head that individuals can do. The first is, if you're experiencing it or if you see it happening, you should intervene and first make sure that the targeted person is safe. Because again, people are getting attacked physically. And so you want to make sure that person is in a safe place. Don't try to engage with the perpetrator because they want a platform. They want to yell and be angry. And so you just want to remove people or get yourself out of that dangerous situation. You got to set boundaries and say that language is racist. That shoving, that spitting is uncalled for. So you got to intervene. That's the first thing. Secondly, you got to report, because what we want is to have a collective voice, right? If you just sort of complain, people think you're just whining or dismissing. But when you hear so many people experiencing the same thing, that's a lot more powerful. And people realize this is a significant issue, not just for Asian Americans, but this is a significant Californian issue. This is a significant American issue that's reached, crisis proportions. It's not an Asian American issue. It's other people's problem. It's their racism. It's their issue. They got to take care of it, right? So we need to report. And this, again, you can report even if you're a witness to something. This is what I say to a lot of people is everybody's part of a group, a school, a faith-based organization, a corporation. Get that site to make an official statement denouncing anti-Asian racism. I used to think these little resolutions and statements were just symbolic, but now I think they really matter to counter Trump's racist speech. When he said the term Chinese virus over and over again, it opened up hate. It gave license to hate. And we need to counter that hate by calling people to empathy, by calling people to respect, by calling people to love. It seems really dumb and basic, but we need to do that because right now America is acting really idiotically. America is acting pretty stupidly and spitting and coughing on elderly people. So we need those statements. And the process of gathering the statements and having it come from the top really is a part of the learning process, part of the engagement, talking about the issue process, and it's helpful. I think it helps Asians feel seen and heard. Fourthly, you could shop at Asian businesses. People were shunning us. Racism has led early closures of Asian businesses. We have the second highest joblessness rate in the country. And so a lot of Asian workers got laid off. So if you go back and patronize Chinese restaurants, Vietnamese nail salons, that helps the community. And fifthly, you can donate. You can donate to Asian American groups who are working to fight the racism, to escort seniors, to support COVID-19 vaccinations.
Beautiful. Thank you so much for all of that and for taking your time. I know you're really busy right now. I have one last question, and it is the question that I ask everyone who comes on this show because I am a joy hunter. Where do you find your joy these days? Well, today I run a lot. And so in Oakland, we have this Redwood Park with the creek was bubbling now. And I just ran along the stream and listened to the creek. And there's deep, deep joy to be found in the woods. Beautiful. Thank you so much. We all need to get out into nature.
Yeah, it's forest bathing. Go forest bathing.
Yes, yes. I love this phrase. Well, thank you, Dr. Jeung, so much for joining us. And, we'll be supporting Stop AAPI Hate however we can. And just massive appreciation and love for what you're doing for the community.
Okay, thanks for having me.
Absolutely. So you see the address, stopaapihate.org. If you see any instances that you want to report, visit the website. If you got Asian folks, Asian fam that need to report, help support doing the work. And you heard Dr. Jeung, and we're going to give you a little bit more from Dr. Jeung about Stop AAPI Hate at the end of the show. now we're and I mean we're getting there. We're getting pretty close to the end of the show, y'all. So you know, we know it's been a little heavy. It's been a little heavy tonight. So I wanted to leave you with something a little lighter. You know, we stay on this joy hunt. You see the hoodie? Yeah, musthavejoy.com came through with the new gear. So we want to leave you with something a little lighter. You know, we stay on the joy hunt, and it just so happens that finding joy is more scientific than you may think. As we find out in this week's It's Called Science.
Matter whether you've got a huge group of friends or if you're in the perfect. Have you ever heard of the Harvard study that ran for 75 years to assess what makes us happy? It's a revolutionary study in psychology. It followed the lives of two groups of men for over 75 years, and it now follows their baby boomer children to understand how childhood experience reaches across decades to affect health and well-being in middle age. So what keeps us happy and healthy as we go through life? If you think it's fame and money, you're not alone. But according to psychiatrist Robert Waldinger, you're mistaken. As the director of a 75-year-old study on adult development, Waldinger has unprecedented access to data on true happiness and satisfaction, and he lays it all bare in this TED Talk.
Keeps us healthy and happy as we go through life. If you were going to invest now in your future best self, where would you put your time and your energy? The clearest message that we get from this 75-year study is this: good relationships keep us happier and healthier, period. We've learned three big lessons about relationships. The first is that social connections are really good for us and that loneliness kills. Second big lesson that we learned is that it's not just the number of friends you have, and it's not whether or not you're in a committed relationship, but it's the quality of your close relationships that matters. And the third big lesson that we learned about relationships and our health is that good relationships don't just protect our bodies, they protect our brains.
So the biggest predictor of your happiness and fulfillment overall in life is basically love. Specifically, the studies showed that having someone you can rely upon helps your nervous systems relax, helps your brain stay healthy, and reduces emotional pain. The data also clearly found that those who feel lonely are more likely to see their physical health decline earlier and die younger. It's not just the number of friends you have, and it's not whether or not you're in a committed relationship. It's the quality of your close relationships that matters. It doesn't matter whether you've got a huge group of friends or if you're in the perfect romantic relationship. It's the quality of the relationships that count the most. How much depth and honesty exists within them, the extent to which you can relax and be seen for who you truly are. This is a great reminder to prioritize authentic connection with others, because the data is clear that in the end, you could have all the money you've ever wanted, but without loving relationships, you won't be happy.
Hey, so you know, it's science, y'all. And you know, last week on the show, both of our interviewees talked about the importance of relationships to accomplishing two very different goals, and that's combating misinformation and achieving health equity. This episode, we've been talking about racist violence towards Asian Americans, and studies show that the most effective way of reducing racism and prejudice is also through relationships and connection. And that just about brings us to the end of episode 21, y'all. Yeah, that's so if weeks were years and this show was a person, it could go get drunk legally, but it wouldn't, because overconsumption isn't healthy and it's a health live stream, but it would for sure have a glass of red wine a night because it helps the heart and the memory. As always, y'all, I want to thank all of our incredible broadcast partners who help us reach half the internet with this show every week, and to our partners that protect us, who keep the lights on over here at ZFG Studios. And remember, we can stop Asian hate, and we can make sure Black Lives Matter. All we got to do is smash white supremacy everywhere that it shows up, and there are all kinds of ways to fight that fight. For Netta, Allison, Suchita, Avani, and the rest of the Masked Up team, like Mazi said, health is wealth and I need my bag. Covered face, no case. Health doesn't come from a pharmacy, y'all. Till next time, stay masked up. And we're going to leave you with some words from our guest tonight, Dr. Russell Jeung, about the important work that Stop AAPI Hate is doing and how we can support.
Stop AAPI Hate, we are trying to get at the roots of racism and to address the sites where racism pops up. We know that youth are getting bullied a lot in California schools, so we want to promote ethnic studies. Ethnic studies has been proven to help students of color raise their GPAs, stay in school. It also helps in building racial empathy, understanding each other so that they wouldn't mistreat each other, that they see each other in each other's shoes. Secondly, we really want to expand civil rights protections and the civil rights enforcement. In California, we have the Ralph Act and the Unruh Act. The Department of Fair Employment and Housing covers that. And we want to encourage people to make use of the DFEH if they get harassed in stores or private businesses. It's really useful. They provide translation. You could get mediation. And mediation is a really restorative justice model that we want to promote. We want not to incarcerate people or to criminalize communities of color even more, but we want to restore individual to individual, to hold perpetrators accountable, but to heal them, to educate them, and to help transform the communities so that they wouldn't commit crimes. And that leads to our fourth sort of policy approach is community safety. Again, we want to get at the roots of crime and street violence, and that means upfunding our communities, providing more mental health services so people don't act out, providing more economic opportunities so that they won't commit crimes out of economic opportunity. So we think these four approaches, ethnic studies, expanded civil rights, mediation and transformative justice, restorative justice, and then community public safety efforts, things like community ambassadors, where we have local residents welcoming people to their neighborhood rather than patrolling a neighborhood. We think those are actually evidence-based practices that work, that can reduce racism and can reduce violence.